We're about to get started and do our injections. You can see the markings that we have for each of these individual dimples. Now, she actually has a pretty good situation. We've been very liberal in what we're treating here. And she's got a beautiful shaped butt, good volume, but when she's standing, each one of these little marks is an indentation. And some of them are deeper than others. So when we do an Aveli treatment, it is going to release the bands and make what would otherwise be a dimple smoother. The deeper they are, ironically, the better they will be. The more shallow ones, they're harder to make better because they've got less tension. And when you cut the bands, they don't pop up as much as the deeper ones. But we're going to try and treat all the ones marked, and then we'll see how she does as we follow her progress. Now, I'm using a needle to inject. You can see this is the area that's already been injected. You can see the change in the surface of the skin. That kind of orange peel look, the peau d'orange. I've got my needle tip there, and as I inject, you'll see more of that appearance. You can see the whole injection coming in as I spread the local anesthesia throughout the area. See it again. Just like that. Now, in order to do this procedure, we need this special device. This is a single-use device. We use it with one patient and throw it away, and it is the Aveli device. This is what we use to cut the little bands that make dimples, and let me show you how it works. When you have a dimple, there are these bands that are pulling the skin down, and when you cut the bands, the skin has a chance to pop up and become smooth. Sometimes it can scar back and pull again, but most of the time when you release the bands and the skin pops up, it keeps that shape because when the skin's firm, it'll create a nice smooth shape, and the tissue will kind of pop back and won't scar that way again. And we do it with this device. This is going to enter the skin, and then once it's underneath the skin surface, that little red light shows me where it is. And you can see through my gloved finger, you can see where that light is all the way through all that tissue. So as we're just at the tip of the skin, you can really see where it is. And that light, as you can see, is right behind this part of the device. This part of the device is where we do all the work. When I push a button on the handle, it extends this little arm out. And that arm is what's going to grab a hold of the bands. When I push a button, you'll see the arm exposes a tiny little blade right there, right in the middle, next to the shaft there. There's a tiny little blade that's been exposed. When we've got the bands hooked, we push that little button and whoop, cut through the little bands when that blade is exposed. Then we let go, retract this again, and reposition to get another band. Now, we've made a tiny little incision. That incision is in the little fold. When she stands up, you'll never see it. Of course, the scar is going to be negligible. Even if you're looking for it, you'll hardly be able to find it. But that tiny little opening allows us to get the device underneath the skin. You see the red light. We're going to make our way to the first spot we're going to treat. And we'll go to this one here. Get the red light just past it. Extend the arm. You see I'm pulling. You can see it's pulling the edge. I'll push my little button, and that's it. We've gone through some of those bands. You release the device, get it in position again. You can see it's pulling, and release those bands right there. Now I'm getting into the dimples here, just releasing a little bit, and I've basically using the arm now, checking to see that this is totally released, and it does feel completely released. And as I'm moving all this around in here, our patient is awake, and she is willing to give you guys a little update on how she's doing. So, am I hurting you at all?
Not at all.
And how bad were the injections on a scale of 1 to 10?
I'd say about a 6.
Okay, so they were a little painful.
I felt a pinch.
Pinches
A
and
little burn,
then burning. Uh-huh.
Yeah,
And now that we're working, what do you feel?
nothing.
Perfect. perfect. We've got these tiny little incisions, and we're going to put one little buried stitch. This is an absorbable material, and we're not going to have to take it out because it'll just sit in there and absorb. And that one little stitch is going to make this seal very nicely. I could leave it open, but just putting that one stitch, you see, it makes it look perfect. Here is the dimpling in the butt. You can see a number of dimples in both sides of the buttocks. When we take a look at the oblique views, you can see that in clothing, some of this might show through. If she was wearing sheer clothing, the depth of some of these dimples is enough that it might be visible in like a sheer, like a Lululemon type of thing that she might be wearing. Well, it looks different now. Let's take a look. You can easily see how smooth and flat everything is in terms of the dimples. There's no dimples here at all, and this side had more dimples. This side had fewer but deeper dimples, especially across here where it was almost a flatness. And if we just turn a little bit, you can see that same view. It has a nice roundness to it now, and looking here, you don't see all that speckled dimpling that she used to have. So, you know, this is a really, really great result. And we're only at 1 month. She's softened up. Everything feels reasonably normal. Just a tiny bit of discomfort. And within another 2 to 4 weeks, it'll be as if nothing was ever done.